everyone, my name is Amy Fiedler. I'm one of the Cardiothoracic Surgery Fellows at the Massachusetts General Hospital. It's my pleasure today to moderate this panel regarding transitions from residency to practice. We have a group of great panelists today. Starting over here, we have Dr. Ahmad Sheikh from Kaiser San Francisco, Dr. Joe Cleveland from University of Colorado, Dr. Ravi Ghanta from Baylor, and Dr. Mara Antonoff from MD Anderson Cancer Center. Thank you guys all so much for coming today. So I think one of the major questions that a lot of residents and fellows have is the decision when you're exiting residency and fellowship if you should move forward with an academic or a private practice job. What are your thoughts about that, and how should residents go about making that decision?
It's obviously a very personal decision for each individual to find a career that matches with their personality and their goals for the future. You asked how one should go about figuring out which path they should take, and I think it's important for residents to get a good idea of what life would be like in each of those situations. Some people know from the very get-go, the thought never occurred to me that I wouldn't have an academic practice, but I think if there's a resident that's contemplating both options, it would be very helpful to spend some time seeing what day-to-day life would entail in each of those scenarios.
I would endorse it. I think probably exposure to both, both things, which a lot of residency practices have, or residency programs have, some exposure to both academic and private settings. Clearly, if you're somebody, again, who is know that you want to do research and teaching is not exclusive to academic programs. That can be done in good multi-specialty large institutions too as well, but particularly if you have a passion for any type of investigative science and that sort of thing, then clearly that would set you on an academic pathway.
I think a couple of things. The first, when you're in the crucible of training, it's often hard to lose sight of the world beyond the circle of training. And one of the most effective pieces of advice I got was to actually identify mentors both within academia and outside of academia, and spend time with those mentors outside of the clinical environment to really try to get a handle on what drives them, what their life is like, and what professional and personal types of things fulfill them, and see if that matches up with you as a human being. Mm-hmm. So I found that to be very valuable when trying to make the decision.
Mm-hmm.
I think every resident should be very open-minded and consider all potential aspects that their career can go, and they should spend some time early in their training doing some significant introspection about what really motivates them and how they see their life moving forward. I think there are wonderful opportunities in both academic and private practice. Just because you go into private practice doesn't mean you can't do academic things. There are many private practice groups that participate in societies and do meaningful clinical research, and so I think that possibility is open to you, so I think you should be open-minded about the different aspects of things. I, as an academic surgeon, am motivated by the ability and opportunity to train residents and the ability and opportunity to perform more basic level research. And if that's something that's important to you, then that's a consideration. But you should be open-minded and consider all the different possibilities.
Mm-hmm. I think that's a great jumping off point, Dr. Ghanta, when you're thinking about performing research and you're early in your career. Can you touch upon how you were able to do that and how you found the time and how you were able to balance a busy clinical practice with your research interests in order to facilitate academic productivity?
That's a great question. I think it's very challenging as a clinical cardiac surgeon to integrate research, specifically basic or translational research, into your career. And I think a lot of it has to do with your own motivations, your own goal setting and time allocation, and then a lot of in the environment that you choose to start your career. If you're at a place where your mentors and other colleagues are doing that, then your likelihood of being able to achieve it is much higher. Your boss, your division chief, or your chair has to value that and allow you to allocate time towards that. And it's very challenging as an entry cardiac surgeon to actually allocate time to do research instead of clinical things, because you're kind of really, your heart is often also in the clinical arena and you want to spend as much time there. But if you have the right mentor and leadership at the institution you're going to, you have to allocate the time to do that.
Mm-hmm.
I would echo that and also add that I think, again, looking at the infrastructure that you have at your institution is very important, and being able to really leverage, if you will, these types of relationships, again, with your division chief, your department chair, other aspects, and also find some people you can collaborate with. So for example, when I look back, and your career may change, when I look back in my first 5 years, I was very much intent on getting outside extramural funding, thought that was critical to establish myself, and to do that you really do have to, in a way, I don't use the word protect, but you just have to allocate your time to the point where you can actually still be busy clinically, but just say that there's a certain part of the day, or sometimes a Saturday morning or something, where I'm just going to think about these things and write grants and do those sort of things. It requires discipline, like most things do, to really sometimes even say, my plate's full. No, which is hard for us to do. We're not genetically programmed to do that, but I think it's really important you protect, in some ways, your career.
Mm-hmm. I think that's such a great point. I would add to the fact we're all discussing how challenging it can be as a busy surgeon in order to find time for research. And when we look toward collaborators, for me as a general thoracic surgeon in academics, when at a major cancer center, when I'm looking for collaborators, sometimes it's helpful for me to look outside of the realm of surgery. So not only basic scientists, PhD investigators, but also even finding medical oncologists with whom to collaborate, or finding cardiologists with whom to collaborate, or finding other clinicians that may have a different work-life balance than we surgeons do, and may be able to chip in and help with getting the projects going in different ways.
Mm-hmm. I'd also like to add, obviously echo everything that's been said, that research comes in many forms, and today more than ever, I think various institutions, whether there are large multidisciplinary private practice type groups like Kaiser or traditional academic institutions, value non-clinical effort that drives the institution or the field forward. So if there are passions that you might have in the area of education or entrepreneurship or things of that nature, where you can build these collaborative connections and contribute to the institution, community, and field, don't discount that as kind of research type activity that you can engage in.
Mm-hmm. To change gears a little bit, some of the concerns that I hear from my fellow residents and fellows who are graduating is how much support would you get when you enter a new practice with your clinical work? So when you're done with training, if you have a challenging case, would we go about talking with the folks when we're interviewing for these jobs about what type of support and availability we would have from more senior level surgeons? And how do you all think is best to start that conversation, or have that conversation in a non-threatening way when you're in a job interview?
I can lead off with anecdote and tell you that actually it's essential. And again, just as you identified different mentors, there's somebody you have to feel, if you will, comfortable in the group that you can, run difficult cases by. And I can tell you, no matter how well trained you are, and everybody comes out very well trained, I'm convinced there are things and situations you'll find yourself in your first couple of years where just you can't predict, and you need somebody you can call. So I had a fellow faculty member that I had stayed at the same institution that I trained at, that kind of would, again, was on speed dial, and was willing to come in and help me out whenever, and that's invaluable. And so in a way of paying it forward, I certainly will, when people come and interview, and we've hired 2 new associates, say, listen, I'm always here, you can call me anytime. So I think that's just something that you need to almost get up front before you sign.
Mm-hmm.
I completely agree. I think the first year coming out of training is extremely critical, and you need to make sure that you go to an environment that is going to be supportive, and that is something you can try to ascertain during the interview process. And when you do have a complex case, I would expect a supportive environment to help you with that complex case. So on an interview, sometimes you can kind of see how it's going to be by asking, if I have a complex case, what do you recommend the approach be? Is it that I run the case by my senior partner, and the senior partner either A, takes the case and protects you from that complex case, or does the case with you? And I think that's an important component, because as a kind of more junior surgeon, you often, especially in academic institutions, the cases that get referred to you tend to be more complex and tend to be high risk. And you know, you want to prove yourself, so you kind of go out and do these cases. And I think it's very wise to make sure that you get your senior mentors to help you with these operations, especially in the first year.
Mm-hmm.
I was going to say one of the best things about a good training program is it lays the groundwork to basically tell you how much you really don't know. You know, like when you get out, that's, you know, when a lot of your true maturation and learning happens. And one thing that I found useful is that when you're interviewing, let's say, because the question is specifically how do you gauge that when you're interviewing, you can ask the folks you're interviewing with, what was it like for you starting with this group, or what do you see as a young surgeon, what do you see as a progression in the group? And you'll get a very good sense of how that group feels with regards to mentorship and bringing you along. Because really the success of any group is in the success of training the youngest surgeons in that group.
Having gone through that interview and job search process not too long ago, I'll tell you this was something I was very interested in understanding. And the way that I approached it in interviews was by communicating that I felt very fortunate to have received outstanding training at the institution that provided me with my cardiothoracic residency, yet I fully recognized with humility that the learning curve continues to go on for quite some time, and that if I were to come to work at this location, I of course would always want to put patient safety first and foremost above my own ego, and how would they suggest that I get the support that I need in order to ensure that the patients are always cared for to the best of the institution's ability. And I think that that's a pretty good way to phrase it so that they understand that you're not incompetent, you're not scared, or maybe they don't know you're scared, but it's a good way to show your own competence, but that you're humble and you just want the best thing for the patient.
Mm-hmm. That's great advice. And finally, I'd like to touch a little bit upon work-life balance. So as residents and fellows, we certainly devote the majority of our life to work, and I think the majority of us are looking forward to having a bit more of a balance when we graduate from training. Can you all comment upon how you've achieved that throughout your careers, and especially as you've started off?
Certainly offer that it is incredibly critical. And I can tell you that, again, almost as I mentioned, in terms of having just kind of compartmentalize is not the right word, but just you have to structure certain things. You have to, at certain times, just be able to say, you know, this is something that's important to me. And I encourage, you know, find something you love to do outside of medicine, whether it be gardening, walking your dog, being with your family, playing golf. For me, it's golf. And so that's something that I just said Saturday mornings, you know, obviously if you're operating, doing a transplant or something, yes, but there are times when that's just kind of my time. And again, I grew up with my boys playing, and that was also good family time. So it's critical.
Mm-hmm.
Yeah, I think it is absolutely critical and essential. And you know, really the important thing is to get time management skills. And it's something that we don't have as much of in residency, because everything we do in residency is an immediate requirement response. You usually have to do something and get the task done. Whereas with work-life balance, when you're a faculty surgeon, is more of organizational planning and setting what the priorities are. For example, if you are going to take your family to soccer on Saturdays, you have to make that a priority and come up with a structure to make that happen. And so I think you know, coming up with an organizational plan to get those other work-life balance priorities in check will be essential.
I couldn't agree more. And you know, I understand the perspective from a trainee who feels like there isn't work-life balance. And as you enter your career, perhaps even rather than thinking about it as work-life balance, there may never be balance, but work-life integration is incredibly important. And kind of going back to what you asked about, whether you want to do academics or private practice, for me to be able to make a choice that on a weekend, while there's a meeting in a city where my family lives, that I'm here, it's because I have a passion for this. I love this society, I love the meetings, I love all of the committees and work groups that I'm very fortunate to be a part of. So in order to integrate those two things, you have to recognize what's important to you. And ultimately for me, I'm a mother of 3, and so as I think about work-life balance, it's important for me not only to be there for my children, but also to set an example, for them to see me passionate about something and knowing that I'm making an impact on my children, but also on my patients. And for me being in academics, I feel I can leave an even larger imprint in the field. So I think there are a variety of ways to look at it, but if you think about work-life integration and how you can make everything that's important to you have a place, that's probably the best approach.
Mm-hmm.
I think I'd like to bring up something you mentioned earlier, which is practicing to say no. And that may seem, I don't mean to seem flippant in saying that. Actually, the ability to, for most of us, career always takes priority, and that's the truth. We restructure our entire lives where we live, what we do for the majority of the day. Most of us spend more time at work than we do with our families on a day-to-day basis. That's just the truth. And it actually, once you're out of the obligations of training, the ability to step back and actually give something else a priority to the point where you will say no to professional obligations actually is a bit of a transition. And as a junior faculty member or junior partner, it's not going to be easy, and you're not going to be able to do it for risk of not making the next step certain times. But that is a transition that does happen, and you need to be cognizant of it, and you need to invest in it. You need to be able to say no to professional responsibilities for whatever your life entails. It might just be you sitting there, binge watching Netflix, and that's fine. No one needs to know. It's okay. But you need to be able to say, no, I can't do this grant. No, I can't do this type A dissection on a Saturday when I'm not on call. And it's very hard to do, but if you want to make your life a priority as well, you have to learn how to do that. And if you're in a good environment, your partners will respect that.
Mm-hmm.
Back to what Mara said, I think passion is something we all have, and so it is in a way almost controlling that in a way, but I think you're exactly right, setting some boundaries around some things and being able to say, we are all incredibly passionate. I mean, friends of mine that aren't in medicine say, what are you guys? You go to a nice city on a Saturday and sit inside? Who are you? But that is who we are, because we care enough about what we're doing, but at the same time, we have to also just take those boundaries again, where you can say, this is where I'm not a heart surgeon, I'm just doing some other things that I love to do.
And it does get better. It really does.
Yes.
I tell trainees all the time that you keep waiting for that light at the end of the tunnel, and I feel like I'm basking in the light. My life is everything I wanted it to be, and I really do think that work-life integration is completely possible. We all, many of us have families and hobbies and so many other things outside of this world that we are very passionate about. So there is a light at the end of the tunnel, and it's very real.
I think that's a good note to leave it on, so thank you everyone for watching.